The state's infertility industry is questioning its future following a first-of-its-kind decision from the Alabama Supreme Court on Friday.
Now, Alabama's highest court classifies embryos as children, and that decision came out of a lawsuit brought by two couples seeking damages for the accidental destruction of several embryos at a Mobile reproductive health clinic.
News 19's Kayla Smith has been talking with advocates, doctors, and families confused by this ruling, and they say they're concerned the court's order will mean the end of medically assisted conception efforts in Alabama. Kayla?
That's right. Several women have told me that undergoing infertility treatments is a very emotional process. It's expensive. You have to maintain strength and hope in the face of a lot of disappointment. One woman says she and her husband don't have any children yet, but they're preparing for a second round of IVF or in vitro fertilization. Now, after months of testing and planning, they feel like the rug's been pulled out from under them. I've been contacted by a number of people across the state with the same concerns. A Huntsville fertility doctor tells me his clinic and his patients are facing plenty of uncertainty.
It was shocking, and I knew immediately what the implications of it were.
Dr. Brett Davenport is a reproductive endocrinology and infertility specialist offering care to North Alabama patients. He says he works in a field that seeks to protect life and understands why this decision was made. In its opinion, the Supreme Court said Alabama's wrongful death of a minor law applied to all unborn children, regardless of their location.
Where I think they might have not done due diligence is seeking expert opinion in understanding the ins and outs of the laws that they're creating.
The court's opinion cited Alabama's abortion ban, stressing that the state had chosen to protect unborn children, and said this decision was consistent with the Alabama Constitution.
I think my mind is still wrapping around all of the implications of this, and is also wrapping around the risk that, our clinic is willing to take should this not get overturned in a speedy fashion.
Barbara Calora, the president of the National Infertility Association, says the court's decision calls into question the legality of many of the steps crucial to the IVF process.
If this fertilized egg is now a child, can we freeze them? Who is potentially criminally liable? Is it the people who created those embryos? Maybe it's the embryologist, or maybe it's somebody in the fertility clinic. We simply don't know.
The experts point out one more complication to consider. The majority of the embryos created will not result in a child.
You can start putting blame as to why, when, and where, or you can rejoice with the 25% and rejoice with the couple that now has a child they never would have had.
Advocates also expressed concern Friday's opinion will lead other states to follow suit, making it harder for families to get medical help to have a baby. In the court's order and dissent, the justices urged the Alabama legislature to take up these new questions as quickly as possible.